We're live.
Hi, I'm Hibah. I'm SHCS Chair of Student Health and Wellness, and today we're here to talk about monkeypox. I'm here with.
Hi everyone, my name is Blake Flaugher. I use he, him pronouns, and I'm the Sexual Health Promotion Specialist in the Health Education and Promotion Department at Student Health and Counseling Services. I'm repping the Love Lab today.
My name is Lindsey Gaydos. I use she, her pronouns, and I'm a public health nurse here at Student Health.
Hi, my name is Dr. Cindy Schorzman. I'm the medical director here at Student Health and Counseling Services at UC Davis.
And before we get started, I did just want to say we all are wearing masks because it is required in this building. We're in a medical facility, so that's why we'll be wearing masks throughout the live stream. But yeah, just to get started, on behalf of ASCCD Student Health and Wellness Committee, we're so happy to hear about all of campus's efforts regarding monkeypox and vaccination availability. I know that there's a lot of misinformation regarding monkeypox, and I hope that this live clears up any misinformation and addresses any questions the student body may have. So to start, first question is, what is the current state of the monkeypox outbreak? Are cases increasing or decreasing?
Yeah, so great question. I think that's one of the reasons that, we're here today to talk about what the current state is and how things are going on campus and around the country and California. So we're a long way from where we were when, at the height of the outbreak over the summer. So, because people are getting more access to vaccines, they're getting vaccinated, they are, many people have changed their behaviors. Maybe they're having less sexual partners. So it's been there have been multiple reasons why, but cases are decreasing. They've actually decreased like 8-fold from the height. And so right now, the CDC data are showing that there's about 40 cases every day in the US, and that was as of last week. So yeah, we're going in the right direction. However, I do think it's important to say, while people are getting vaccinated, while cases are decreasing, it doesn't mean that MPOX is still not an issue. There are disparities in who is accessing the vaccine. We do know that people with the least access to the vaccine are the ones that are getting more infections now. So actually, they're showing that, or current data are showing that Black and Latinx men, mainly men who have sex with men, are contracting MPOX still at like 5 to 6 times the rates of white MSM counterparts. So very important to make sure that we're getting vaccines to the people who need them the most. But things are on a general population level moving in the right direction. And I do think it's important to say, because MPOX it's still declared a public health emergency. Many health departments across the country, those emergency declarations are set to expire by the end of this month. California Department of Public Health, from what I've read, as of this morning, doesn't have any plans to end that, as far as we can tell. So we still are in a sense of emergency where we do need to make sure people are getting vaccinated and they're being aware of risks.
Thank you for that information. So going off of that, can students get the monkeypox vaccine at Student Health and Counseling Services? If so, who can get it and how much does it cost?
Yeah, so I'll take that. So we're really excited to provide vaccine, and any student who's eligible for our services here at UC Davis Student Health and Counseling is eligible for vaccination in general. Specifically, though, the criteria for vaccination are determined by the CDC, the California Department of Public Health, and by our local county, Yolo County. So the way that we set this up is that we want our students to be able to self-identify if they meet the risk criteria of a group who's at risk of contracting monkeypox. And so MPOX. So it's really simple. People just need to go to their HEM, hit messages, new message, go to medical services, and then fill out the MPOX vaccine eligibility questionnaire. It's some basic questions, and through that, people can just say, yep, I meet the criteria, and that's all we really need to know to be able to get you onto the list to schedule an appointment. It is free, so it's just like the COVID vaccines, which we also provide here as well. So regardless of insurance status, doesn't matter. This is free. It's provided by the government. There's no charge for coming in and getting this particular vaccine. And ultimately, we just want people to come in and get the vaccines. As Blake was saying, it's really important that people continue to remember that this is a problem and that we get the people who are most impacted to come in and get vaccine. Similarly, we also want to remind people that if they have a new lesion or they had sex with someone that had a lesion or they were notified by a friend or close contact, they might be concerned. We also provide services here to kind of do testing or counseling or anything that you might need. Final little piece is that if you're thinking about the monkeypox vaccine, I also want to encourage you to do HIV testing. And so that's just something to think about.
That's great to hear. Another question. So we know that some eligible students may be hesitant to get the vaccine because it can leave a long-term mark on the forearm. Could you tell us more about this and if there are any ways to prevent it?
Yeah, so I'll take that again and I'll defer to Cindy if she wants to chime in. So ultimately, there are two ways to get the vaccine. One is called subcutaneous, and that means it's the back of your arm. That was kind of the standard way that people did the vaccine before. But over the course of the summer, we were able to expand the access. The CDC now says you can put it as an intradermal vaccine, meaning it goes into the skin. The standard place that most people do that injection is here on the forearm. Obviously, that's a pretty visible place. It's not a super painful vaccine. It's more like kind of an insect sting, or it's like a TB test, if you've ever had a TB skin test. But people are concerned because it can be within the range of normal to have a lasting mark, or kind of redness, or something that even kind of looks like a little bit like a bruise on the forearm. So in result to that, the CDC has said that we can do these kind of alternate injection sites that aren't as common and that people don't normally think of when we do an intradermal injection. And one of those is over the area right here in the deltoid. Another one is your upper back. And so that's, if people are really concerned about the idea of there being a mark, you can totally ask for one of those sites. We are happy to offer that here at Student Health, but if you're going to a different site, we ask, you might want to check to make sure that their injectors are comfortable giving those alternate sites. In terms of the mark itself, I do want to be clear that putting it here versus here versus here doesn't actually change the local reaction that your skin might have. It just kind of changes the visibility of it, right? Like whether you have something here versus here versus here. And ultimately, there isn't a whole lot you can do to make it not have a mark. Everyone's body is different. Everyone's inflammation response is different. However, best practices for kind of wound care would be to keep it clean and dry. If it gets really itchy or is a little bit painful, you can take an oral over-the-counter medication like an antihistamine. And you can put just like creams on it, but the CDC is very clear. They don't want people to put topical drugs on it. So things like a steroid cream or an antihistamine cream specifically. So those are kind of general tips.
The other thing I would add is if you are someone who really wants this vaccine but has a significant history of scarring, especially keloid scarring, which is a particularly aggressive kind of scarring, absolutely let us know or let your provider know, because we are able to administer it subcutaneously for those individuals, which reduces their chance of scarring. So if you're worried about that, absolutely come in and we want to talk to you about options.
Okay, great. Thank you guys for answering those questions.
Can I add to that actually? So also think it's important. I got mine. It did leave a little bit of a mark, but you know, it itched for a little bit, but it's fine. And now I'm protected. I'm actually 14 times more protected now that I've been fully vaccinated with both doses than I would be otherwise. And so that's exciting. But hopefully it goes away. But it doesn't bother me personally. But
Thank you for sharing that.
Yeah, to kind of chime in on that, so it could last for a couple of months if there's a little bit of mark, but we can't predict whose body is going to have which reactions. And again, we just encourage, if you have concerns, please still schedule for your vaccine, but we've got nurses and folks who are really happy to talk to you about your concerns and address them.
That's great. Well, thank you all for answering those questions, and thank you for coming here and being a part of this conversation about monkeypox. Yeah, that's it.
thank you.
Thank you.
Appreciate it.
That's it. It's all over.